So Adductor Magnus, as we know, comes from the inferior pubic ramus and goes posterior as well, sort of coming off the ischium as well, and cuts down, runs medially down through here. So it sits posterior to adductor longus, which will be the most prominent in the proximal medial thigh here. So you would move posterior to that and palpate in there, which you could use a little bit of adduction to bring it up. So just adduct, yep, relax, or a little bit of hip flexion, but that'll also bring up the hammies. So as we said, what you could do is you could isolate it with a bit of hip extension. So extend your hip, and you can see my finger pop up there, and then you can isolate the medial hamstrings by some internal knee rotation. So I'll resist you internally rotating. Relax. Go again. I can just feel those hamstrings just gently popping up there. So that isolates it. So in the sort of roughly the proximal 2/3 of the muscle, you'll needle posteriorly, because the femoral artery runs anteriorly until it goes through the adductor hiatus down through here, where you think about depth as well as you also think about needling anteriorly to avoid the femoral artery. So this, I've isolated the muscle here. Make sure you're not needling gracilis over the top. There's gracilis there, so push that up there. And there's adductor magnus there. So with where I'm needling here, I'm about halfway down the thigh. So theoretically the femoral artery should be in front. So we'll needle medially and tip it posteriorly. In this position, you can needle multiple points along here as well.